Hello, my name is Miss Amanda Tozer. I'm a consultant gynaecologist subspecialising in reproductive medicine. And I'm going to talk to you today about some what I think are the basic tests needed for infertility. There are three essential things you need to achieve a pregnancy: the production of an egg, sperm, and the ability for that sperm to get to the egg, in other words, open fallopian tubes. So there are three basic tests that you need to have done. The first is to confirm whether or not you are ovulating. Now clearly, if you are having a regular cycle, you are most likely ovulating. But there are specific tests that you can do to check that. The most common test is something called a mid-luteal progesterone level. The timing of this blood test is important, and that is why I describe it as mid-luteal. The luteal phase of a woman's cycle is from the point of ovulation to the point of bleeding. For most women who have a 28-day cycle, the luteal phase is 14 days, and therefore the mid-luteal date is day 21. Obviously, if you have a 30-day cycle, this would be day 23, and so on. The luteal phase is always 14 days and therefore needs to be calculated accordingly. A blood test can be done with your GP, or it can be done in a specialised fertility centre. Often women pick up tests in the chemist called ovulation prediction tests. These are very good tests, and what they do is they predict something called an LH surge. This occurs approximately 24 to 36 hours prior to ovulation, and those urine tests are extremely accurate. If you are going to do those tests to look for ovulation, I suggest you start them on approximately day 10 if you have a 28-day cycle, so that you do not miss that surge. Obviously that may vary, of course, if your cycles are different lengths, and you can seek advice from your GP on when the best time to do those tests is. If you are not ovulating, then of course you do need to seek help. The second test, of course, is a sperm test. Sperm tests are very easy to do. Again, you could go and see your GP, or you can have a sperm test done in a specialised centre. The interpretation of the results is very important, that you see somebody who knows what they're talking about, of course. But a sperm test is very important to do, as it can be an early indicator of a problem and can certainly dictate what type of treatment might be needed. The next thing, of course, is a fallopian tube test. I would not do this test until I had ensured that the sperm was entirely normal. But the fallopian tube test should be performed, and is usually performed in a specialised fertility centre. A tube test can take two forms: either a hysterosalpingogram, which is essentially an X-ray, or a hysterocontrast salpingography, which is essentially an ultrasound scan. The advantage of the latter is that you also have an ultrasound scan which looks at your ovaries and the outside of your uterus and your pelvic organs. A hysterosalpingogram is a very simple procedure. It takes about 20 to 30 minutes to perform and involves the start off like a smear test. A catheter is placed inside the uterus and a dye is injected and followed along the tubes by means of ultrasound scanning. The procedure is a little bit uncomfortable, and you should take some Nurofen or Brufen approximately 20 minutes before the procedure is performed, but it is done as an outpatient procedure and you recover very quickly afterwards. The information is provided to you at that time. People often ask, when's the best time to do these test investigations? How long should people wait? Well, by definition, you're not said to have an infertility issue until after you've been trying for 12 months. And that means trying where you're ovulating regularly on a monthly basis for 12 months. However, this of course depends upon what other problems, there may be other things in your history and your age. So it's very individual, and if you feel that there's a problem or that you would like to be tested or investigated sooner, then you should be. Of course, undertaking fertility investigations can be extremely stressful. In fact, trying to conceive can be extremely stressful. The most important thing is that we're here to help you. I run all tests, basic tests, including sperm tests and of course hysterocontrast salpingography. And please do come if you're concerned or have any worries, please do come and see me.